Good morning. So class, today in this seminar, we're going to be talking about malaria in the context of COVID-19 infection. And this is mostly because there's very little that has been done in the context of COVID-19 and malaria, since this disease is a new one. And what the questions are, what do we know about this context, and what research questions are needed to respond within the malaria endemic context. My name is Dr. Lwidiko, and I'll be your facilitator today. So to get an idea, COVID-19 classification includes countries, in terms of countries. There are countries with no cases, countries with sporadic cases, countries with clusters of cases, and countries that have community transmission. And this is almost slightly different with the malaria classification in terms of there's a high transmission areas, moderate transmission areas, low transmission areas, and areas that are in pre-elimination of malaria. So this kind of sets the context of how to understand this epidemiology and how these diseases are being classified. So, and when you look at the most recent data with regards to the distribution of COVID-19 cases, you can see Americas are the ones that are cumulatively leading within this COVID-19 cases, but they are normally not very much affected by malaria compared to Africa, which is least. The data shows that the proportions of people affected with COVID-19 is quite low in terms of the cases and also in terms of the deaths. And Africa is 95% of the cases of COVID-19 within an African context. So most people affected the old people, but in the COVID-19, but the picture is changing. But severe disease is mortality linked to all age, male sex, and comorbidities because they have ACE2 receptors, which are more. I'll talk about this in a moment. But the malaria high transmission area mostly affect pregnant women and children due to lack of immunity against malaria. Now you can see these are two different age groups and population categories, but there are some indirect effects of COVID-19 to malaria, right? So the COVID-19 pandemic has the potential to seriously undermine health systems in the sub-Saharan Africa with an increase of incidences of malaria cases, but also there are studies that show that the interruption in the activities that are related to malaria transmission, for example, the distribution of med nets and things like that. The countries that are projecting and expecting an increase of this disease moving forward. So the clinical picture again. So malaria parasites usually normally enter the liver cells, enter the body, enter liver cells, they multiply, they get into the recirculation, they multiply in red blood cells, they burst, they release these cytokines, which are inflammatory mediators like IL-6, IL-12, TNF-alpha, that leads to fever and a clinical disease. And in severe disease, these malaria parasites, they go and block the blood circulation, they lead to low oxygen in the blood, tissue hypoxia, lead to lactic acidosis and acute respiratory distress syndrome, which is a common feature in cases of COVID-19. But also issues like increase in metabolic demand leads to hypoglycemia, increase in red blood cell destruction leads to severe anemia and tissue hypoxia, and sequestration leads to an increase in pro-inflammatory response, as I've said. In COVID-19, coronavirus enters the respiratory sectors through the ACE2 receptors, which are mainly in the nose, liver, nose, stomach, mouth, and even they go and replicate in the heart and the liver and the kidneys. As they replicate, they increase pro-inflammatory response and lead to alveolar destruction, especially in the lungs, and oxygen transfer is being reduced, leading to ARDS, which is acute respiratory distress syndrome, similar to what I said. And SARS-CoV-2 antigens also they cause inflammatory storms, which is IL-6, IL-12, TNF-alpha. These are the same things that we've seen in the previous clinical picture of malaria, and also reduces the red blood cells lifespan. And there's an increased tendency to form blood clots that cause disseminated intravascular coagulopathy. Now, where do these things overlap, right? So clinical presentation of COVID-19 ranges from asymptomatic to major issues like fever, cough, difficulty in breathing, shortness of breath. Patients may also present with some non-specific symptoms such as headache, fatigue, myalgia, GI symptoms such as diarrhea, vomiting. Some of these could be not uncommon in COVID, but also they can present with not inability to smell. So these are also the same symptoms you see in malaria, right? So sometimes, I mean, it could be a patient that comes to your clinic that has malaria, and because we're in the COVID situation, they're being suspected more of COVID, and you miss a patient who suffers from malaria, and then it might lead to misdiagnosis, and a patient might get severe malaria eventually and die. Thank you for your attention.